Okay, well, first of all, thank you very much for allowing me to speak to you today about dentistry and oral hygiene and everything that goes along with that. So a little bit about me. Brother introduced me already. Mohammad Khalil is my name. I studied at the Wayne State University for my undergrad initially, and then I went on to the University of Detroit Mercy for my dental degree. So, dentist, most people don't like us, we understand. So why do we have to go to the dentist then? The biggest reason usually is what? Something hurts, pain. There's a big hole in your tooth, and what happens? You have to come see us. So that's one reason. What's another reason? Sometimes maybe some bad breath or something doesn't feel right. Your teeth feel loose. Why does that happen? So one of the things that happens is we get what we call gingivitis. We've all heard that word before, right? Gingivitis. How does that happen? What happens to the body that a problem happens? So, does anybody here eat food? Okay? Okay, two brothers eat food, very good. I do too. What happens when we eat food? We chew it and we swallow. Of course, everything goes to our stomach, but some remnants get left behind. And the example I always like to give is, what happens when you touch wood and you get a splinter in your arm? And you don't remove that splinter. Well, the tissue or the skin around that splinter starts to get irritated, turns red, and blood pools in that area and to try to push that splinter out, right? So what if you don't remove that splinter? Well, the area gets more red. It becomes more irritated, and it may even hurt. And that's kind of what gingivitis is. And that's after you eat, you get that food caught there, it's something stuck. So what do we do with that splinter? We pull it out. What happens to the area? The area starts to bleed, but it's a good blood, because that bad blood that's been pooled there, it's finally been released, and the healing process can begin. So gingivitis, that inflammation of the gums, can be corrected. How? By brushing, right? That's the reason we have to brush our teeth, because we eat food. Now, since most of you are not eating food, I guess you don't have to brush that often. That's great. But for those of you who are eating food, you have to brush to remove that material off your teeth. What is that material? We call that plaque. It gets stuck to your teeth, it gets stuck around your teeth, and mechanically is the only way to remove it, okay? Gingivitis, if you don't brush properly or floss properly, gingivitis starts to get progressively worse. It turns into what we call periodontitis. Periodontitis is then the inflammation of the underlying bone. So if you ever looked at a skeleton, you see, the skull, I should say, you see all bone. You see the teeth, and you see the teeth and bone. You don't see any gums on it. So it's that bone that holds that tooth in place. As that bone starts to deteriorate, fall away, what happens? Well, the tooth is only so long. So as that bone melts down away from that tooth, what starts to happen? The tooth will start to get looser and looser. So sometimes there are patients that have never been to the dentist, nothing's ever hurt them, and they come to the dentist in their 30s, in their 40s, in their 50s, and nowadays, unfortunately, even younger. They say, "Doc, everything is all right, but look, my tooth is kind of loose." And I take a look and I say, "Well, you waited too long." And on cavity-free teeth, perfectly healthy looking teeth, I pulled them all out because there's nothing holding the teeth in anymore. So besides having a big hole in the tooth, it's the supporting structures that we're trying to maintain maintain its health, and that's what gives us the overall cleanliness of the mouth. Okay, so how do you remove the plaque, and how can we avoid it to getting to periodontitis? So periodontitis can be completely avoided. Gingivitis, everybody sitting in this room, we probably have. I don't, because I knew I was presenting and I brushed my teeth and flossed before I came, okay? So, what time did we brush? Well, most of us brushed this morning. It's 8 o'clock now, so we probably woke up 7. It's been over 12 hours, and we've got a couple more hours to go, and we haven't brushed our teeth. Luckily, we're Muslim, and we do rinse our mouth throughout the day, so that helps quite a bit, okay? That helps to reduce those acids, and I'll explain that in a minute, but in general, in America, we're not rinsing our mouth, right? Americans, I should say. We eat breakfast, we brush our teeth, we eat breakfast, we eat lunch, we we eat dinner, some snacks, and then maybe before we go to bed, we brush our teeth. If we can get in the habit of just even rinsing our mouth during the day a little bit, it helps to reduce that acid. So, one of the ways, I said mechanically is the only way to remove that plaque, as to remove that splinter from your arm. So, brushing, for how long? 2 minutes, that's it. Now, if anyone's ever stared in the mirror at themselves for 2 minutes, it's a long time. It takes some time to get in there and just brush, and you're looking at yourself. And I've timed myself several times, and even I catch myself being surprised to see how long 2 minutes is when my kids aren't bothering me and I'm just standing there and doing it correctly, okay? So time yourself, try the 2 minutes in the morning and at night, and you'll be surprised how long 2 minutes is and how fast we usually brush. Mentally, we're brushing for only about 20 seconds. That's what they say. So practice, get a timer, time yourself, and 2 minutes is a long time there, okay? What type of toothbrush should you use? A mechanical, a regular toothbrush? They all work, okay? Everything works. You just have to use it. Obviously, it's cost dependent. I always recommend a $1 toothbrush works just as well as a $80 brush from the store. And you can time yourself, like I said, 2 minutes. You don't need the timer on it, okay? So, we talked about a little bit about brushing. How do you get cavities? Does anybody know? Is it just you eat candy and the candy rots your tooth? No, we all have bacteria in our mouths. So when you eat that food, you didn't brush that plaque away, that plaque is now left behind, right? When that plaque is left behind, well, we have bacteria in our mouth. What does that bacteria do? It eats that food that's left behind, and it starts to produce an acid. What does that acid do? That acid is what starts that cavity. It starts to wear down your tooth. It starts to put up literally a hole in your tooth. That's what a cavity is, okay? It happens to adults, it happens to kids. What's the difference between adult teeth and kids' teeth? Nothing. It's just physically smaller, okay? So that means when a child has that much acid from soft drinks or from candy in their mouth, it's doing the same type of damage as it would do to an adult tooth, except that their teeth are just physically smaller, okay? So, for our kids especially, I've been in Lansing 2 years, and I've been around, it's amazing how much decay or cavities kids still get, and it's simply from lack of brushing and just maintaining oral health, okay? So what you eat matters quite a bit, right? Acidic foods will wear down your teeth. Everything wears down your teeth, but how can you maintain it? By brushing, by flossing, and by maintaining it so that plaque is gone. If the plaque is gone, there's no gingivitis. You're never going to get to periodontitis. There's nothing for the bacteria to eat in your mouth, so you remove the chance of getting cavities, and your breath will smell better, and you'll have a better looking smile, okay? So, brushing does everything for you that you need it to do. And the biggest thing of that is, you'll get to see me a whole lot less, okay? This really makes a difference for pregnant women. How does, a lot of the times we hear a lady will come and say, I had a baby and it leached all my calcium. Well, a tooth is fully formed when you're a youngster. So by the time you're 7, all your teeth are formed. Okay, so when you become pregnant, the baby cannot leach that calcium or anything else from it. What happens is we tend to eat a little bit more often, we tend to snack a little bit more often, and what happens therefore is you get the gingivitis, you get the inflammation, you get the plaque in your mouth, and it's that constant acid in your mouth that is causing the cavity. It's that constant nutrition for the bacteria. I always like to tell my patients that just like we need food to eat, to do whatever we need to do, the bacteria need food. And that's that plaque that's left behind to do what it needs to do. And again, what does it do? Produce acid. That's its only job, and that's what damages our teeth, okay? The more we can reduce that acid, the healthier our teeth will be, okay? So definitely, pregnant women, you definitely want to do what? Rinse your mouth. Brush more often because of the snacks, okay? So for our wives and our sisters, we just remind them, hey, if you eat, it's okay, just rinse your mouth. At least it will help to what? Reduce the acid. The more the acid level you reduce, the overall, the less chance of a cavity you're going to get, okay? And obviously, Once a baby is born, how soon should they see the dentist? We always say the sooner the better, and it's less for the child. So you usually get your first teeth around 6 months. It's physically difficult to treat a 6-month-old, but luckily they have no problems. But it's a reminder for the parents to say, hey, the baby's got teeth, make sure you start brushing, because the second that tooth comes in the mouth, the chance of cavity come right away. The only way to avoid getting cavities 100% is to remove all your teeth, okay? And I don't think anyone is ready for that just yet. So once that child has teeth, it's not for the child, it's for the parent as a reminder. Say, hey, get in there, brush it. If you can't brush it, wipe it with a wet cloth. And obviously a child will be on the bottle for a year, 18 months. At 18 months, they help almost all their baby teeth. So if they're falling asleep with the bottle in their mouth, what is in that bottle? Milk. What's in milk? We're in America, sugars, right? Everything has sugars. So when they go to sleep, those sugars stay in their mouth. And what happens to those teeth? They get all rotted. And unfortunately, I've pulled teeth on 2-year-olds, the front 4, continuously. So those don't fall out until they're 6, 7 years old, and little poor kid has no teeth from the age 2 to age 6. And it's not a long-term problem, but obviously it's a short-term problem for a couple years. And it's psychological too for the child. Oh, so I have bad teeth from day one. So it's when the child is young, we really reinforce to the parents, hey, it's up to you to brush their teeth up until the age of 5 at least. After the age of 5, they become more independent. They understand how to hold the toothbrush. They understand how to get in there and brush a lot better, okay? Before that, my kids, I have a 4-year-old. She's in pre-K here. She just does this, She does a good job of keeping it in her mouth, and she tries to keep it in there for at least a minute and a half, but she's not getting or hitting or brushing away the plaque that's in her mouth. So what do? Give it good practice. Now let me do it. And I have her open her mouth, look in the mirror, and I go around all her teeth. Little small circles. You're pretending you're brushing all your teeth there, okay? And the more you do it with a child, you'll be surprised. I always hear, once I start with my child, they want to brush their teeth all the time. And that's great, because they've learned that habit from early on, and it just, like everything else, sticks with them, okay? One thing I was going to mention, brushing and flossing, obviously. There is one toothbrush out there they don't sell in the stores. It's called the Rotodent. That's the only one that's equal to flossing. Nothing beats flossing, but the Rotodent, they say, is equal to, okay? So you can only buy that at your dental office. So, I wanted to just kind of repeat one more time about cavities. That's the biggest thing, that's the most common problem that we see. So, how do you get cavities? What did I say? You eat food. Once you eat food, the bacteria also get a chance to eat that food. Once it eats that food, the acid starts to be produced. How do you reduce that acid? If you're at work, I always tell my child, when you eat your lunch, go to the drinking fountain. When you go to the drinking fountain, rinse really good, because even in pre-K, I guess they don't have the time or whatnot to brush their teeth. It's okay, but it helps to reduce that acid level in your mouth. What else can you do? Gums. Chewing gum helps, of course, sugar-free. And the issue with a little bit of sugar-free gums, take a look at the rest of the ingredients too. Sometimes there's other sugars in there. So, it may say sugar-free, and we all know how advertising is. It may not be exactly sugar-free. So check the packet. I've seen recently some gums specifically approved by the American Dental Association. I'm assuming then there's less of the natural sugars and it's all artificial sugars. I'll let somebody else explain if that's healthy for you overall, but at least it'll help to reduce that acid level because it helps to produce saliva in our mouths, okay? So for our kids, I've seen some of our kids that attend the masjid, and alhamdulillah, most of them are in pretty good shape, luckily. Not too bad. But then you see other kids that aren't in such good shape. So, if you ever see somebody, just say, remember, brush your teeth, kid. It's just a reminder to our little ones, and just to keep them healthy, okay? So, what's another reason you would go see the dentist? Well, another reason would be something happened outside and you fell down and your tooth broke. So, you get a fracture. There's not much options for that, except you just come and see us and we take care of it. But what happens if the tooth comes out? What if a child is jumping, falls down, and his whole tooth comes out, and it's an adult tooth? If you fall and your tooth comes out, what do you do with it? Well, try to go to a dentist, any dentist, immediately. But if it's whole and you know exactly where it came from, oriented properly. I mean, you can tell the front and the back because you're looking at you can feel your other teeth. Wash it off if it's a little dirty, put it right back in. We have 30 minutes. So if it's a Sunday at 9 o'clock in the evening, nobody's open, and you fall and that tooth comes out whole, put it right in. You got 30 minutes, okay? And the more time you take, the less chances of it working. If you can put it in within those first couple of minutes, the chance of that tooth remaining in your mouth your whole life and nothing happening with it is 99%, okay? If it's a weekday and you're at school and your child falls and it's your whole tooth and you're nervous and you don't put it in and you want to see the dentist really quick, don't put the tooth in your pocket. If you don't have any milk around or anything else like that, you put it in your mouth, okay? Put it in your cheek. You at least want to keep that tooth moist. Water's okay, they say, but it's not the best medium for a natural teeth. So if the child is old enough to keep it in its mouth, leave it in the saliva there, okay? Get to the dentist and we'll put it in ASAP. It doesn't matter, you don't have to come see anyone specific. Anyone will see you, and they will take care of it ASAP, okay? And another reason, of course, if you have nice looking teeth, everything is going well, you're brushing, you're flossing, what's the next thing people want? Nice white teeth. So what do they want? Bleaching, right? Is bleaching good or bad? It's fine. There's no negative repercussions of bleaching your teeth, okay? But why do teeth change color? From food, right? Age, just like your hair, right? So the color of the tooth is not something we look at in terms of health or non-health, okay? You can have gray teeth, you can have yellow teeth. It happens less in America now because we know better, but if you took certain medications or a pregnant woman took certain medications while she was pregnant, and if you do those medications before a certain age, before 7, they will stain your teeth and leave a mark, maybe your whole tooth or maybe a certain area of your tooth. And those are what we call intrinsic stains. Those are very difficult to remove, but bleaching helps, okay? So how early can you start bleaching? They usually say teenagers. The earlier you start, the better it is. Do you have to come see the dentist and get a professional tooth whitening? You could. I always recommend to my patients, try something cheaper first. What's cheaper? Crest Whitestrips. Go to the store, it's like $50. It's gonna whiten your teeth slowly, okay? But the slower you whiten your teeth, the longer it's gonna take to go away, okay? What happens if you come and see us and you whiten your teeth in 24 hours? Well, the chance of that going away is a lot faster. And the sensitivities are higher than too because of the chemicals being used, and they affect the teeth in that way, in just sensitivity. But usually it goes away and you will be fine with that, okay? So Crest Whitestrips, I think is a great cheap alternative that will do a nice, not the bright Hollywood smile, but a really nice smile, okay? And it's not so expensive. So that's kind of the general information about teeth, acid, plaque, and bacteria in your mouth. More and more in younger people, luckily, knock on wood, I haven't found anything in anybody's, but we're seeing a lot of lesions in the mouth, or lesions are problems that end up being cancer. And why do they end up being cancer? Because of cigarettes. And I'm glad I don't see a lot of people smoking here, but it is still a problem if they're smoking. Smokeless tobacco, chewing tobacco. Kids do start at e-cigarettes. You know, they say that young people are using those. It's still nicotine in there, but they haven't done as many studies. I haven't read as much about that to see how much damage that's doing. But if there's ever a problem in your mouth and you don't know what it is, see us. It's quick, it's easy, and we can say, is it serious or is it not serious? Most lesions, if you rinse with some warm salt water for a couple days, they usually go away, okay? If you have an ulcer, it's called a canker sore, you'll know what they look like. They look the same every time, so once you diagnose it once, you'll know for the second time. They come and they go after a couple of weeks, okay? But if it's something serious, if you ever have a lesion, you don't know what it is, it's not going away, you're rinsing and it's not going away, you don't feel it on the other side of your mouth, it doesn't feel normal to you, it's not healing or it's bleeding, that's something definitely you want to see. The quicker we can diagnose something, the quicker you can treat it, the better the success rate, okay? And so besides the acid that breaks down our teeth, what about Pepsi? What about soft drinks? What about, my wife used to love sucking on lemons, okay? What do they do to your teeth? Do they cause bacteria or anything? No. What they do is start to wear away your teeth, okay? Teeth can only take so much. So when you're constantly sucking on something, any type of habit that you have that's negative for your teeth will, in the long run, wear your teeth down, okay? So you don't want to be sucking on lemons. They're really acidic and they start wearing away. And it doesn't act any different than Pepsi. Pepsi and soft drinks, they get your back teeth. Lemons, they get your front teeth because all the acid hits right there, okay? Okay, so that's the gist of basic dentistry. In dentistry, there's a lot of new technologies and whatnot coming out. Things are becoming easier. Hopefully, the biggest stories we hear are that, when I was a kid, the dentist treated me bad, and now I'm afraid. So fear is a big, big thing. But, one of the things I learned in school, and I think things are changing, is talk to your patient, right? So the dentist, when you go to anybody, if they don't introduce themselves, if they don't say hello, you have to make that decision. Is this where I want to stay? I like to sit with my patient and explain, here's what I see in your mouth, here's what's going on, and here's how we can go about solving your problems, solving your issues, whatever the case may be. I know sometimes in the rush world, they just come, okay, we got to do this, see you later. Dentistry is a little bit different than medicine in this regard. When you go to see a dentist and he recommends certain treatments, we'll have exact procedure codes. Like, okay, I'm going to do this, I'm going to do this, I'm going to do this. There's going to be a code associated with that and a fee associated with that. So that way at least you'll know exactly what's going to happen and you can break it down for yourself. Is this what I want or is this not what I want? Don't be pushed into treatment. There are people out there who will say, hey, you need to go in and you need 20 crowns on your teeth, 20 caps. If someone tells you that, get a second opinion, right? It's easy like that to go and say, hey, that guy said I need this. Do I need it? It'll help to say, yes, you do, and here's why, or no, you don't, and here's why. It's a little bit more specific, I should probably say it that way, than versus so general, okay? So that's the overall of dentistry. If the more often you can brush your teeth, keep those acids down, you'll reduce the bacterial level will stay the same, but you'll reduce the acid content. You reduce the acid content, no cavities. If you're brushing well, no plaque means no gingivitis. And if you can maintain that your whole life, you'll be very happy, okay? And that's basically dentistry in a nutshell, quick, simple, not so complicated. If there's any specific questions or catered to you, or, feel free to ask me anytime. Try to come more often. You'll see me with after school or anything else like that. And I'd be happy to answer you if there's, like I said, a specific question or a general question. So I'd be happy to answer any questions, if there are any. Yes?
You mentioned flossing before, and I know it's important.
Yes.
And I understand it's recommended at least once a day. So my first question is, do you recommend flossing like at the beginning of the day, the end of the day, or somewhere in between?
Thank you very much.
And my second question is, do you recommend using like mouthwash?
Okay. So if you are manually brushing all the plaque away, you got all the plaque on the surfaces of the tooth that you can see. Where didn't you get? In between your teeth. So you have to get mechanically in there to remove that plaque. Okay? So flossing is important. The more often you do it, the better. At nighttime is the best time. Why would nighttime be the best time? Well, again, at least during the day, if you go and eat right now, you're awake, your mouth is closed, your mouth automatically starts to produce a saliva to help neutralize those acids, okay? What happens when you go to bed? You just ate, and you're so tired, you go to bed. Well, you may sleep with your mouth open. Well, the food is still there, the bacteria is still there, the acid level is going up, but there's no saliva to counteract it, so it's having more of a detrimental effect to your teeth. So the most important time to brush, and thank you for bringing that up, is definitely before you go to bed and to floss right after. So my regular routine is floss to get all that stuff out, and then you brush afterwards, okay? Mouthwash. Mouthwash is fine. Alcohol-free is better because it doesn't dry out your mouth, but it's an extra thing. So what does that mouthwash do? It makes you feel good. Something's burning, so it feels like it's working, and it makes your breath feel good and taste good. As long as you brushed and flossed, I can take it or leave it. Sometimes I would recommend it for a child. We'll see a small little cavity. I have a question on the x-ray. Okay, you know what? It's a small enough cavity. You don't have a history of cavities. Let's keep an eye on that tooth. But if you just keep an eye on that tooth, you want something additive to help to remineralize. And so there's a rinse called, a mouthwash called Act Fluoride Rinse, okay? Now a lot of Listerine has it, Scope has it. That would be the only time I'd really suggest it, but in general, I can take it or leave it. It's not the most important thing for me, as long as you mechanically remove all the plaque. Okay? Thank you for that question.
Jazakallah khair. Barakallah. Question. Last week I took my kids to the pediatrician dentist.
Okay.
And I saw little diagrams. It shows that if your teeth are bad, it could affect the mid part of your body up to the knees. They were picturing that.
Okay.
Is there any connection between the middle part and then up to the knees?
Sure. There's no direct connection. What they say is if you're not brushing your teeth, if you're not taking care of your oral health, you're probably not exercising as much, you're probably not doing these other things as much. So, more and more in older adults, they're finding some issues. For example, plaque buildup in your mouth can lead to plaque buildup in your heart. There's no direct relationship. There's just anecdotal comments, issues. There hasn't been enough research to give that link directly. Okay, people see their dentist usually more often than their maybe physician unless there's a problem. So they say go to your dentist for those reasons, but there's no direct link to say this is connected to something down here or over there. It's pretty segregated. Any problems, stay up here. That you have up here, stay up here. Okay.
Using soft brush.
Yes.
Versus
no question about it. So, brushing with a soft brush versus a hard toothbrush. Well, what kind of soap do you use? Do you use a hard soap or something to scrape with like a battery cleaner? No, it's soft tissue. No matter how hard your teeth are, it still can wear away. It can still chip and break, right? So what you should do is hot water. Get the bristles of the brush nice and soft, okay? And even if you don't use toothpaste, you brush, if you get that plaque off your tooth, what do you need fluoride for? What do you need toothpaste for? What does the toothpaste do? The toothpaste basically, like the mouthwash, makes you feel good. Feels good. I brushed my teeth. You got a good taste in your mouth, right? But if you remove that plaque, you're done. How about Mouthwash? I forgot to mention that. Does a Mouthwash work? Sure, it works really well. It doesn't floss. I'm sure they might not recommend it. It doesn't get in between your teeth. But if you're brushing or using it, you're getting majority of that plaque off your teeth. It's better than nothing for sure. Okay.
How often I need to change the toothbrush?
So they say every 6 months. So how often should you change your toothbrush? Every 6 months. The toothbrush should look the same. Can you hear me? Okay. So how often should you change your toothbrush? Right? They say every 6 months. Bacteria will obviously grow on your toothbrush. So how can you clean your toothbrush? Right? Microwave 2 minutes. Put the head up, get a cup of water, put the head in the water, and microwave it for 2 minutes. That'll kill a lot of bugs on it. Okay? You can do that periodically. I do it once a month for my kids because they don't brush their teeth only with their toothbrush. They brush everything else. So. But I should also, the brush should look the same. My dad, for 14 years of telling him, the brush is all bent out of shape after several months. You're brushing too hard, Dad. Soft brushes, nice and gently. It's not how hard you brush, it's how long you spend brushing. That's what matters. Okay. Anything else?
Familiar with the insurance part? Sure. Because there are some people, I know they don't have dental insurance.
Yeah.
Sometimes they face a tooth. So, what do you recommend in such case? What are the
So, have insurance. Okay. So, that's it's a difficult thing to talk about, but insurances. If you don't have insurance, what do? Well, first of all, everyone wants to see you because you're paying cash then, for sure, right? Funds are limited, what do? I actually brought a list with me, and I'll leave it with you, Brother Tessin. Just several things I found. There's several places we can go. The county clinics, there's other places, there's donated dental services, but it's difficult. There's not so much out there. I was reading something about the Affordable Care Act, the Obamacare. Most people, but it affects kids more. Almost all kids will be insured dentally with the Affordable Care Act. Adults, they say an increase of about 10%. So it is difficult to find those places. Here, if you guys see me, if you know somebody personally, please don't hesitate to tell me at all. But outside, I did find a couple areas, local areas that do see patients that may not have any insurance. They're in pain. They're pretty busy throughout the year, but it's on a first come first served basis. But there's just not a lot out there. I could only found actually 6 locations. Even for general, what if you have not just gingivitis, periodontitis? A good option actually are the dental schools. They're just not close by. In Michigan, we have 2. In Ann Arbor, University of Michigan, and then in the Detroit area, University of Detroit Mercy. And in fact, some of my patients, maybe they have a missing tooth, and they want to do something about it, and they say, what can I do? And if I recommend something that's a little bit more expensive, like an implant, if anyone's ever heard that word, if you're missing a tooth, you can put an artificial root in place. It's like if you break your leg, they put that metal rod there. They're mini ones. They put it where your tooth used to be. Something like that, it's so much cheaper to get at the dental school. And it's not somebody trained to be a dentist. It's a dentist like me trained to be a specialist that will put it in. But you're looking at a third of the cost. So we have a lot of patients that sometimes there's some teeth I can't pull, right? So I have to send them to an oral surgeon. It's not cheap, right? The private practice oral surgeons. So we send them to the dental schools. It's 1/3, 1/4 the cost, and it's completely worth it because they get the same care, just at a lower cost. So I will leave the list with Brother Tessin, or if you want to see a brother, but that's all there is out there. Okay.
Sometimes you lose your 2 and 3 teeth in a partial denture. If you are not using that partial denture, it is bad for other teeth also.
Okay, so, certain things have happened to you in your life, you're missing a tooth or 2, and you've received some treatment for it, and then if you don't wear it, well, first thing, you'll live. That's what I always tell my patients, everything will be okay. Somebody once mentioned that at a course I took that, you can remove all your teeth, and you can swallow a chicken whole, and God Almighty, He made this body so that it can still digest. So teeth are sometimes not just for eating, but for appearances, right? If you don't wear your appliance, it's like braces. What will happen if you don't wear braces? Well, your teeth will be crooked, but you'll function, life goes on still, you know? It's for, I want my child to have perfectly straight teeth because that's what we see all the time. What if they don't have perfect straight teeth? Well, they can still brush and floss and keep them healthy, so they'll still be okay. So if you don't wear your partial, you don't wear this, or you don't wear that, you paid for nothing. That would be the end of it. Anything else? Okay, well, I definitely appreciate. Okay. Anytime, like I said, if you guys have any specific questions that regard to you, I'd be happy to answer. And thank you very much. Jazakallah. Assalamu alaikum.